Hey, folks, this is Dr. Kevin Jefferson. I humbly serve as the chair of the Podiatric Medicine and Surgery section of the National Medical Association. Thank you for watching this video. We're going to be talking about primarily regenerative medicine. I have with me as a guest, as my guest, not just my guest, but my homeboy, full stop. I was one of his attendings when he was a resident at Howard University,
Yes,
and
sir.
it's good to see your kids grow up, man, isn't it? So he's here in the DMV. He's doing good work. He's going to talk about himself, about what he's doing. Then we're going to get down to the nitty gritty. First of all, IJ, appreciate you, man.
Thank you for
All
having me.
right, proud of you,
Thank
man.
you.
To
I
see you come
appreciate
up
it.
the ranks, man. I remember what it was like. It is not easy
No,
starting to practice from scratch. Go ahead, man. Go ahead and
thank,
introduce the folks. What's going on with you?
thank you, Kevin, Dr. Jefferson. My name is Ijeoma Nwuju, and I work at the Foot and Ankle Wellness Center, located in Bethesda, Chevy Chase. Just moved there this year, and we're doing a lot of good work there. A little bit about my background. I did do my residency at Howard University back in 2014, 18, and Dr. Jefferson first day definitely taught me a lot, especially in surgery and wound care. So uh, now, fast forward, been out of residency, maybe what is it, 2025? Wow.
Yeah,
It's,
it goes fast, man.
oh my God.
It goes fast, sir.
Oh, at least almost 8 years, 7 years. Um, I'm in private practice. It's wonderful. I love what I do, and I'm just here to share some of the knowledge and talk about regenerative medicine.
Which podiatry school you attend?
New York College
Is
of
there another? Is
Podiatry.
there any other podiatry school in America? NYCPN, baby. That's what
Yes,
we do.
sir.
New
Yes,
York, we get down with the nitty gritty. We out here in these streets getting in the dirty work. All right. So
absolutely.
if you train in medicine in New York City, I don't care if podiatry, trauma, ER, whatever, you're going to be one of the best trained doctors in the world because New York is going to give you all of it.
Absolutely. Absolutely. And those days in New York definitely set you up for success in
Hmm.
the DMV. And I actually grew up in this area, Prince George's County, Maryland. So,
Fantastic.
yes,
So again, the primary subject for this endeavor is regenerative medicine. We're going to talk about what it is and what IJ is doing with it. And we're going to talk about for podiatrists who have yet to delve in this area, not sure what it is, not sure how to get into it. We're going to talk about that as well. I'm a little hoarse. So I'm going to let IJ try, hopefully, do most of the talking. So when it comes to regenerative medicine, it can be a little confusion about what it actually is. The way you're doing it, the way you're using it, how would you describe it?
I would describe regenerative medicine in a simple way, just technology, medical technology that enables the body to heal itself better or faster.
Mm.
That's how I would put it. And that could span over a lot of different let's call it products. It could be skin grafts. It could be biologicals such as lab-derived cells to help it grow and heal up. If we're talking about wound care, it could be uh, protein-rich plasma like PRP.
Mm.
And for me personally, how I like to think of it is more holistically. I use a lot of laser therapy, and it could be laser phototherapy,
Mm.
which has become somewhat popular in pain management and healing as well.
Right. I mean, you mentioned PRP, platelet-rich plasma, and so PRP is not new. It's been around since before we used the term regenerative medicine, right?
That's true.
And so you look at that. You look at fat injections, uh, all different types of cellular tissue products
Yes.
that we're using not just for wounds, but for Achilles tendon repairs and for plantar fasciitis. Botox is out there big, not just in plastic surgery, but It's available for all types of things, and the different other therapeutic modalities that you had mentioned before. So when a person comes in, let's say, let's call it heel pain, whether we're going to
Okay.
call it plantar fasciitis or whatever it's going to be. What's your approach after you do your initial assessment?
After initial assessment, after I rule out anything really catastrophic going on,
Mm-hmm.
I like to give them a conservative type of outlook. But if they come in and they tell me they've done the stretches, um, they've done the injections with steroids, I really don't like to do, but that's the standard. Some people they'll take the anti-inflammatories and it affects their GI and
Mm-hmm.
everything. So if they come and they say they've done all that, then I kind of want to step into the other realm and offer them other solutions such as shockwave, which we have. I like to offer MLS laser therapy. Um, what's the other one? There is some injectables that you can use. I want to call them stem cells, but
Mm-hmm.
that's not the word that we like to use. But those, if the standard treatment hasn't been working.
Right. So from what I understand of what regen is to basically prod the body into healing itself. Or in this case, we're talking about the foot and lower extremity
Yes.
to heal itself rather than just throwing pharmaceuticals at it or doing surgery.
Correct.
Right. There is some regenerative aspect to a lot of what we're doing in surgery and say wound care now, but the way we're seeing it taught now, the way we're seeing it uh, brought to doctors. You can't go to a podiatry seminar or conference without some type of regen being there.
Absolutely. Absolutely. And for me, I definitely agree with that definition, and that's where I kind of fell into the realm of phototherapy and and there's other companies that do different lasers and things like that. But according to heel pain, or if it's plantar fasciitis, if we're attacking the inflammatory process with things in the regenerative medicine space,
Mm-hmm.
I think that would definitely benefit the patient rather than doing the standard surgical methods such as plantar fasciotomy
Mm-hmm.
or what is it, the ablation,
Mm-hmm.
different procedures that kind of we've been taught throughout residency that are invasive. I think with the amount of the advances in regenerative medicine,
Mm-hmm.
I think that route that's non-invasive definitely helps the patient population um, faster and better.
Mm-hmm.
In my mind.
All right. So we weren't taught regen in podiatry school. We weren't taught really regenerative medicine in residency. Right? That I'm talking about across the board, not just you and I, but across the board in podiatry. Like you said, we're taught standards of care. Anything else after that is really on you, right? So what drove you in this direction?
So I would say coming out, I kind of wanted to do things a little bit differently. I wanted to
Mm-hmm.
focus on a more natural path to medicine. Of course, I did surgery. I
Mm-hmm.
do surgery,
Mm-hmm.
but I wanted something that could get the patients um, well at a faster rate, if not faster, without causing much tissue damage. And
Mm-hmm.
a lot of people don't want to do surgery. A lot of people don't have time to be down that long. So with the in the regenerative space, I think that allows people to get back to their day to day, depending on you know what the situation is.
Mm-hmm.
So it mainly came from conferences and kind of deep diving into what some of the trends were going on, like minimal invasive surgery, kind of like Swift for wards. So I kind of was looking in the area of what technology do we have
Mm-hmm.
out now that I haven't learned before that I can incorporate with my practice to help my patients.
What would you tell your colleagues who are not very educated on regen, or if their interest is piqued? what would you tell them to do first?
First thing I would tell them to just kind of talk to each other, like
Mm,
talk to your different colleagues. When you go to conferences, talk to people, see what they're doing and see what's going on
mm,
basically. That would be the first step. And then there's always representatives and people coming in. And if you have an open mind to doing things a little bit differently,
mm.
that way you'll the information kind of flows to you, so to speak. So and then we have YouTube that can tell you anything. It's hard to navigate it, but I would say definitely just talking to your colleagues and seeing what people in your practice area is doing and see
Okay.
what your mentors are doing and then kind of see if that aligns with your goals and your patient population.
So about how long you been in the regen space now, would you say?
I would say when I first came out of residency, um, I learned about Wharton's jelly and things like that, and I was interested. And we didn't do a lot of it, but I learned about it. And then I want to say when that regenerative space started to pick up, I would get um, sales representatives that would come in and show their products, the sports products. One of them would be for like heel pain, Achilles tendonitis, things like that, and they were having saying they had good results. And I would do a little uh, like research online,
Mm-hmm.
PubMed, and see how it was going. And I would always try something um, to make sure. And if it didn't work, then I wouldn't use it for the patient. But if
Mm-hmm.
it did work and it gave my patient a good outcome, I would definitely use it as a proponent. And if I had issues, I would use it for myself
Mm-hmm.
and see how it would go.
One of the things I like about this arena, one of the advantages I think, is being able to avoid steroids and NSAIDs.
Yeah.
Right? Because we know, like you shouldn't give a steroid injection for Achilles tendonitis. That thing's just going to snap like a rubber band in a few weeks. Right? But now with what you're doing, what you're talking about, we have uh, treatment options outside of pain medication.
Correct.
Pain, as well as dealing with the biomechanical issues, heel lifts, and all the other kind of stuff we learned back 30 years ago.
Yeah.
But I think that we're seeing the arena really spread throughout medicine. Is huge in orthopedics, right?
Oh yeah. Big time. Pain management as well.
So I think that uh, we all need to take a few moments in our day and continue to learn about the different things that are available. That's why it's called practice because you never really get it down.
I
So tell me how, since you've been doing this for some time, how has it helped your practice? How's it made your practice grow and so forth?
So I would say I've been doing it for about 6 to 7 years,
Mm,
and it transformed my practice totally. Mainly, I would say the MLS laser, and then the stem derivative products that we use.
okay.
Um, I can do everything in office. I rarely, unless there's issues, have to go into the hospital, so that changes the pay structure and things like that if you're doing small procedures in the office.
Mm,
Um, and it's covered by insurance as well as non-insurance things you can do in the office as long as it's a ideal patient. So with the, I would say let's say fungal laser. With
mm,
the fungal laser, that can delve into what do you call it? Aesthetic areas like medical pedicures and
mm,
things like that. And it kind of feeds each other because the doctor's on site. You see if they have a fungal problem, if they're a good candidate for the laser. Simple, takes 12 minutes. And then over time, with topicals and the laser therapy, you do get some nice results,
okay.
85%. Then with the MLS laser, that kind of is my baby. That one
Okay.
I use myself. I use myself. I like to run. So whenever I'm having getting older. So sore knees,
Mm-hmm.
just put it on my knees. If my ankle or Achilles tendon is sore, 5 10 minutes in that, and it jump starts me. I don't have a lot of downtime.
Mm-hmm.
Definitely just finished the Marine Corps marathon, first
Okay.
one. And
Congratulations, brother.
thank you,
What was the
thank you.
time?
Oh man, horrible time, but I finished.
Get to the beginning, get to the end.
That's it.
Hey,
Next
the
year.
NYC, the New York Marathon, the last one came across what 15 hours, something like that. Crazy.
Wow, I
It's
finished.
about just about finishing, man.
That's all I wanted to do this year.
Yeah.
Last year I tried, I didn't finish. A
Mm-hmm.
lot of cramps. This year, different strategy. I finished. A big proponent of that is the recovery and using the photo technology that we have.
So you're in a fantastic space, man, because the running community here in DC and the DMV is huge.
Yep.
So I hope you, if you haven't already, getting the opportunity to get in front of running clubs and so forth and so on, especially because you're fam, right? You're just
Yeah.
not some cat from the outside.
Right.
You're on the inside. You with them. You do the training. You know what goes into
Yep.
it, and you know what is necessary for good recovery. And I think you're in a fantastic space. Have you run into any issues as far as coverage? Because we know, like here in DC, Uncle Sam is the biggest employer. So
Absolutely.
DC, greater than 90% of people in this area have some sort of healthcare coverage,
Yep.
unlike other states. DC, we lead the league in insurance coverage. So what are you finding as far as insurance coverage for Regen?
So that's a really good question because my practice, how I set it up, is not really standard. It doesn't. Most of the regenerative procedures I do is not covered by the insurance.
Mm-hmm.
So if I'm trying to help out government workers and everything like that, I try to let them know, like, okay, if you have flex spending, if you have this and that, they may be able to reimburse for these things. Um, it's not outrageous in price,
Mm-hmm.
but definitely there's a challenge of getting coverage on for insurance. Mainly, I feel because there's not as much research out as maybe on the word jelly, maybe on the graphs that they
Mm-hmm.
have, and some of these things cure it. Let's say like the Swift
Mm-hmm.
or something, um, and maybe that's not in the best idea for the insurance or the pharmaceuticals. So how I have things set up is kind of a hybrid. I do some advanced wound care, so I take the standard Medicaid, Medicare, DC,
Mm-hmm. Yeah.
and then for commercial, like the government workers and everything, I do not um, take those insurances, but I offer incentives like
Okay.
military, friends and family, things like that to
Yeah.
help treat the patient population.
Is your population, since you're one of the big providers of regen here in the area, are they coming in fairly educated on what regenerative medicine is? I mean, it's a lot of, you see things online and commercials and stuff like that, and we're seeing more people willing to come out of pocket to recover from injury, to heal wounds, or recover from workout or whatever. And they know that there's coverage issues, but are they coming in saying, "Hey, I saw this. What do you think about this treatment option?"
I would say yes, for the most part,
Mm,
not a big percentage, but I would say maybe like 25%. They've done their due diligence.
mm,
They've looked online or they've seen something on social media and then they went down that rabbit hole and then they would come in, focused on saying this is kind of what I want. I would say half of the time maybe it's something else and after you do your initial examination, you can tell them, all right, you have this is not ideal for you, but you can try this.
mm,
But I would say most of the time at least 25%. They come in fairly knowledgeable, knowing about the technology and kind of knowing where they should go.
okay.
Especially if it's recovery or if it's a runner, they're pretty knowledgeable in what they want.
I mean, so like you, I'm in the advanced wound care space. negative pressure, cellular tissue products, and so forth. And for those who are doing this, you're doing regenerative medicine. So it's a different healing process than your standard stitch them up or try to bring that wound together with tension or what have you, or with time, try to uh, hopefully get granulation tissue so that you can get epidermis. But the advantage we've seen in the advanced wound care space is that these patients are healing without scarring or very minimal scarring. I mean, I've seen cases with patients with wounds this big. It heals up and it looks like it was like it never even happened.
Yeah, it's amazing.
So this is here. It's growing. There's a definitive need, and people are reaching out for it. So, I want to thank you, man, for coming in and talking about this subject. This is something that I still don't think is broached too deeply in schools, podiatry school, medical school, DO, dentistry, you name it.
Yeah,
But always we need to be, as practitioners, always looking at the landscape. Get the pulse of your community. Know what the people want. And like they say in music, give the people what they want.
yeah, yeah.
All right. You don't have to create anything new. There's a lot of stuff out there. Yeah, you got to get there. You got to learn. You have to market yourself. Use all these platforms and everything that we have available. So again, IJ, I appreciate it, brother.
Thank you
Proud of
for
you,
having me.
man.
I appreciate you.
It's good to see one of my babies come up, man. I appreciate that.
Yes, sir.
So thanks, IJ. Again, his information, if you want to reach out to him and ask him questions about regenerative medicine and his experience, his contact information is going to be in the description of this video. National Medical Association, we're going to be in Puerto Rico this summer for our annual convention. So information about joining the NMA as well as coming down the PR for the convention is also going to be in the description. If you want to participate in the podiatry section podcast like IJ and I just did, reach out to me at podiatrynma@gmail.com. And we'll hope to see you soon. Peace out.
All right.